To the University of Evansville and to this GAP Teams project presentation. I'm Jill Griffin. I direct the Institute for Global Enterprise, and we manage the GAP program, of which this project is a part. And for those of you who aren't familiar with the program, any given semester we have about 8 to 10 different projects, ranging from infant mortality to neuromarketing to alternative energy and a variety of other things. This program is designed to give our students experience in the real world, tackling something important and meaningful and providing value. So hopefully, I know those of you who've been working with the team through the course of this semester and also last semester when the team began this project, recognize their work and their efforts and the value that they'll bring. I thought it might be helpful, since there are a lot of people here, for our students to know who's in the audience and what they do. Maybe we just briefly go around and say your name and what you do. So, Mark, you want to start?
Okay, I guess I'll start there. I'm Mark Shifflett. I'm chair of the communication department here at University of Evansville. I am the, I don't know what's the official role, facilitator,
Coach,
advisor.
facilitator,
yeah, something
chief
to that
guru,
effect.
I don't know.
So yeah, but I'm the one that bugged these guys this semester. So.
And maybe before we go to let's make sure we get these.
I'm Emily Fiedler. I'm the Director for Employer Development in the Center for Career Development here at UVA.
I'm Gene Wells, also with the Center for Career Development.
I'm Rob Shelby. I teach sociology here.
Jonathan Smith. I'm the Director of Grants and Sponsored Programs and IRB Administrator and Chair.
Hi, I'm Cindy Schaefer, and I teach in the School of Nursing.
I'm Rashonda Bonds. I'm the CAPE Minority Health Director.
I'm Wael Anazi. I'm an intern with CAPE.
Dr. Ken Spear, Vanderbilt County Health Officer.
I'm Carissa Leahy. I'm the data analyst at the Health Department.
And my name is Lynn Herr, and I'm the Director of Clinical and Outreach Divisions at the Health Department.
My name is Joe Grease. I'm the Administrator at the Health Department.
My name's Cindy Kelly. I work with Jill at the Institute.
My name's Clayton Miranda, and going off Mark's comment, I get to bug Jill.
I'm Annie Sentinel. I'm a senior here at UV, and I work with Clayton in the Institute.
Dan?
Oh, Dan for the Office Technology Services.
All right, then at this point I'd like to turn it over to the students, what we're all here to see and hear from. And I know you'll be excited. We've had an opportunity to see parts of this throughout the semester, and these guys are doing fantastic work. So I'll turn it over to you all for now.
All right, hello everyone. We'd like to say thank you and welcome to the Infant Mortality GAP Fall 2017 presentation. First, we're going to start by introducing ourselves. So my name is Emily Rohr, and I'm a senior biology major going into medical device and pharmaceutical sales.
I'm Corinne Williams. I'm a junior public health major and a Spanish minor.
I'm Lily Robinson. I'm a sophomore psychology and neuroscience double major.
And I'm Kayla Aiken. I'm a senior health comm, and I'm going to law school.
So the first thing we'd like to cover in our presentation is an overview of what we will be speaking about. So we'll first give you a review of what we did last semester, which was the spring 2017. We will cover what we did this semester, which was fall 2017. We will walk you through the methods that we used to conduct our study. We will take you through the findings that we found based off of our methods. We will give you an analysis of our findings. We will present the limitations that we were able to find when we concluded our study. And then we will also give the client, the Vanderbilt County Health Department, some recommendations for continuing this project. So first we'll start with a review. We will go over the recap of what we did last year. Last year was actually our initial meeting with the Vanderbilt County Health Department, and they introduced us to infant mortality, and specifically infant mortality here in the Vanderbilt County area. And that estimation is about 9.1 deaths per 1,000 births. And so that's a very high rate for such a small county. We then identified the target audience based on online information, the demographics that we were able to find from sources online such as Google and some other sites. And then we were also able to promote ABC, which is a campaign, which is the correct way to put a baby to sleep at night, which is alone on his or her back and then in a crib. And then from there, we were able to identify the goals that we wanted to continue this semester, which is specify the target audience here in Vanderbilt County. So although we were able to see what we were able to collect from the online, we were able to see what the target audience here in Vanderbilt County actually believed and what they practiced on their daily lives. So then this semester, we had our initial client meeting back in September, and so the new members of the infant mortality team were able to connect with the client. So we decided that this year we wanted to focus on the attitude that our target audience had towards safe sleep. So how they felt about it, whether they felt like they were educated, and whether they knew exactly what safe sleep was. We wanted to find out who the target audience trusts, so therefore we could see who we wanted to target in further studies. And then also what social media sites they used and which ones they trust for information about their baby. And now we will walk you through the methods.
Prior to completing our research, each team member had to complete a various amount of online workshops. We then sent off our documentations that laid out what the studies would entail to the IRB board for approval. We reached out to multiple resources within the Evansville community, such as CAPE. Rashonda Bonds, who's in the room right now, she is a very big contributor to our studies. Without her, we probably wouldn't have been able to gain such a broad perspective, I guess, of the Evansville community. She helped facilitate our focus groups that we conducted. She helped recruit people for the focus groups and pass out surveys within the Evansville community. We also reached out to the Black Nurses of Evansville. Larissa Madison and Arlinda Payne were a big help to us as well. Our surveys that we conducted, we did online surveys and then we did printed surveys that we passed out through the WIC Clinic, CAPE, Memorial Baptist Church, and then the two focus groups that we conducted, one was through Memorial Baptist Church, the other was through CAPE. We did those in early November, and we used that information to analyze the differences between our focus groups and the surveys, and they ended up being a little bit different in some ways. So
next we'll talk about the findings specifically with the surveys right now. So first we looked at the demographic to make sure that we are hitting our target audience. So we looked at zip code, age, and the race and ethnicity, and then we asked relationships, safe sleep attitudes, who they trust, and also social media usage. So the next slide, so we'll kind of go in depth about what we found. So first was the zip code, and as you can see, our biggest, I guess, hit was 47714, which is right where we wanted. It's right here, right where we wanted in the community. So that was good. And then we asked the respondent to say what their relationship to the child was. So our target audience, we wanted to hit the mothers. So good news, we got 58 of them were the mothers. So that confirmed that we were looking in the right area. And then we asked age, because we were looking in around the 20 to 35-ish range. So as you can see, 39.6% of our respondents are in that target range, and then a lot of them were also grandmothers or older, 55 and older. And then we looked at race. So for our target audience, we were aiming towards the Black and African American population. So we did get mostly those respondents, and then also our second biggest was white and Caucasian. So then to the survey, the first thing we asked was, I am comfortable being separated from my child. And this was on a Likert scale. So the majority of them said that they were neutral, so they just weren't sure, like maybe I am, maybe I'm not. And then I know how my child is put to sleep while in the care of others. 71.3% of our respondents agreed or strongly agreed. Our neutral category was kind of high, so that's slightly concerning just because they're giving their kids to like a caretaker or whatever, and they're not sure how they're going to sleep. I think it is okay for a baby to sleep with a blanket. This one, we would like to see it like strongly disagree, but we found that our respondents were neutral or some of them agreed. So those were kind of higher, which is not the best that we want, but I think the best way for a baby to sleep is on his or her back. This was really good. A lot of people said agree or strongly agree. We had only 11 say that they were neutrals, but overall about 80% of our respondents were pretty on board with this one. I think it is important for a baby to sleep in a crib. Again, many people agreed or strongly agreed. We had about 86% of our respondents, which is right where we want them. I think it is important for the baby to sleep in the same bed as a caregiver at night. Many people strongly disagreed, if not just disagreed in general. So that came out to be 80% of our respondents. 14 were about neutral. That's slightly concerning just because we don't want them to be sleeping in the same bed as a caregiver. So I think the best way for a baby to sleep is on his or her stomach. About 70% of our respondents disagreed or strongly disagreed. 19 were neutral. We would like them to strongly disagree because, as we found in future studies, on the back is the best way. So. And then we asked who they trust for information about the health of the baby in their care. And a little bit over half of our respondents said a doctor, but it was also interesting because the second one was grandparents. So there's a generation barrier maybe, so that was interesting that we found that. What sources do you trust for information about the health of the baby in your care? About 73% of people said doctor, health facility, which is to be expected. So. And then we asked about their social media and what platforms they trust or they use. And a lot of people use social media, but our biggest used one, I guess, was Facebook. So that's where a lot of people are. And then we asked not only if you have social media, but do you use it for health-related information? And it was interesting to see how the numbers changed because a lot of people have the social media, but they're not using it for health-related information. And then we asked if they have a crib, bassinet, or pack and play, and if they have it, do they use it to put their child to sleep in? And so the blue bar shows that these people they own one, but then the red bar shows that they don't necessarily use it to put the baby to sleep. And then we asked who they trust for information about the health of the baby in their care. And again, many people said doctor and grandparents were next. So. And then we asked them to select the social media platforms that they have used for information about a baby's care. So not just health in general, but in specific a baby's care. A lot of people said none, and then Facebook was the second one.
So I facilitated the first focus group, which was the one at Cape, and that had 8 grandmothers in it, and 7 of them were African American and 1 was Caucasian. And then we also had a second one that Kinsey facilitated, and that had 1 grandmother and 2 mothers in it. So we asked them 10 different questions, and we just had them kind of talk out what their answers would be. So the first question was, describe your routine for putting your baby to sleep. So this was my focus group. The main theme of mine was I would put it on their stomach. Mainly because that is the generation where stomach was what you were told. And kind of the biggest thing I heard from the grandmothers is they said, I don't understand what changed. I don't know how it went from stomach to back. So that was probably the biggest thing, is a lot of them still said that they would still put their grandkids on their stomach. In Kinsey's, it was kind of more work, some of them had jobs and they were young moms, and they just said where that baby wants to sleep is where that baby goes to sleep. If it's their stomach, on their side, if I can get them to fall asleep, I usually don't move them. What challenges do you face when putting your baby to sleep? So in my group, they really said it's not our kid anymore, it's usually our our kid's kid or like their kid's kid. So they just said they don't always have everything that the baby is used to in the house they sleep in 9 out of 10 times. They don't have at their house. They don't have cribs usually, and they don't have pack and play, or if they do, it's in the attic and they don't get it every single time. So kind of a challenge is if this is the safe way, they don't have the resources always to make it that way. And then again with Kinsey's, really the biggest challenge was just getting the kid to go to sleep and not worrying about your other kids. It was just the time constraint was a really big thing. What do you consider to be the safest way to put your baby to sleep? Mine was kind of a really big mixed group. I had a lot of people answer that they would definitely still put them on their stomach. And I had one lady who said that she would let her son growing up sleep in the same bed as the older brothers because that was the only way he would sleep, so she really let him. But I had people tell me on the couch, there was not really, like no one really said on the back. And if I did really push the back thing, they all said maybe we would do that, but they would have a blanket or something. We would not leave them just on their back without anything, so. And then I guess one mom in this one did say that she would do the belly because she thinks it's more natural when they're sleeping. It's kind of like how you're holding them. But I think Kinsey's had more people who did understand the concept of putting it on their back, and so they kind of did talk more about understanding it. They just said they didn't always have the time to do it. Talk about where you learned how to care for your baby. This kind of goes well with the surveys. They all really said that they would ask family members, and especially like I would ask my own mom if I didn't know how to do something. And so they also said they would go to the other community members at a church or at Cape, something like that. And then Kinsey's also said they would use family members too. It was kind of all around that it was like a community breach kind of thing. Who do you go to when you have questions about your baby? One lady in my focus group worked at a daycare, and she said she really had moms coming in and asking her questions because they weren't really sure sometimes where or who to go to, and so she took care of kids every single day, and so she was like, I kind of was like their Google source, basically. They would come in and be like, well, I don't know this, and I don't know how to do this, and so she said that because I mean, these moms, or these grandmothers didn't have kids, so it was more of like them answering to other people. They're like, people in my community would come ask me, and we would help them find answers. And then in Kinsey's group, they said, my mom or Google, we Google. What do you think about online information about infant care? My group really said that they didn't have online information when they had kids, so it wasn't really something that they could have used. But a lot of them said that they don't really think it's always the safest choice because it's a lot of different sources and you don't really know who and what source you can trust. She's like, a lot of people make conclusions off of 5 different sources and put together what they want to believe. So they didn't really think it was the best. And Kinsey's group said that they will use it if they like it. Again, they'll use it. If they don't, they won't. And I guess Pinterest, they said they've shared a lot of different things from other mothers sharing. So what we took away from the focus groups. I think it was a very big unawareness of the issue. When I first said it to my focus group, they're like, wait, that's a problem in Evansville? And I was like, especially a problem with like your demographic? Yes, it is a very big problem. So I think not being aware is a problem. You can't fix something that people don't know. I also think there's a very big lack of understanding. They get why. They're like, oh, I know this is safe, but I don't know why it's safe. I know you're telling me to do this, but I don't know why. So you can't get people to change if they're not sure why they're changing. And then Rashonda created this hashtag that was like, our babies are dying. And she had a poster in the room, and everyone in that focus group told me that that was something that was going to make them change. That their group is not going to change based off of some happy and go-get poster that's saying this is the easy way to do it. Like, you need to scare them into changing. You need to make them realize that this is a problem and your children, your race are dying. And it's a huge problem. So I think that was a really, really good hashtag, and the whole campaign idea, they all really agreed that scare factor would be what would be best. And then out of Kinsey's group, she said that they are really up to date of the practice, but they may benefit from implementing a more strict nightly routine, so they know it's safe, but they are kind of lax on wanting to do it. They're more willing to let the kid do what the kid wants to do, which isn't the safest thing. So I think with the age difference, it's a really big thing with the grandmothers who are telling the moms what to do. They don't understand the education part, and with the kids, they don't have the time, so they know what's right. They're just not they're choosing not to do it sometimes.
So now we'll cover an analysis of both the surveys that we passed out and our focus groups as well. And so the most astounding factor that we were able to conclude is that we have very inconsistent responses. Based off of the surveys, we realized that people seemed really knowledgeable about safe sleep and the correct way to do things. But however, when we actually conducted the focus groups, we found that the focus group that had the mothers were the ones that actually understood the knowledge. And as Kayla stated, the grandmothers were the ones that knew what was right, but they weren't really that committed to actually practicing that. And they're the ones that are giving the information to the younger moms in the generation. And then our second bullet point says that focus group 1 indicate a lack of understanding of safe sleep. So that's what Kayla was talking about, with the grandmothers being the ones that don't really understand the reasoning behind safe sleep practices. And so those are the people that we really need to target to further the study to be able to change the behavior. And then Kayla already touched on this a little bit, but it's basically the difference in age groups that is one of the biggest challenges that we are able to see, because from this population, they rely a lot. We were able to tell that from our surveys, that while a majority of the people that answer our surveys were mothers, we did have a large majority answer that were grandmothers or of the older population. And so we'll cover the limitations that we were able to conclude. And so one of the limitations that we were able to see from our survey, and then once we got into our focus groups, is the social desirability concept. And we were able to see this because when we passed out the surveys, people were able to check boxes or write in what they thought was the correct answer, especially on our Likert scale. They were able to say strongly agree or strongly disagree. And so we believe this gave people the option where they saw the correct answer, and so therefore they were the ones that answered with what they thought was correct. And that wasn't exactly the case with the focus groups. When they were asked relatively the same questions, they gave us a different answer. We also had limited participants. So although we did have a large number of participants in this study, it was very limited. We also had limited times with the constraint of a semester. If we were able to continue this study longer, maybe some of the variables would differ a little bit. And then we also had the snowball sampling method. And this basically means that we didn't randomly select people in a community. We had Rashonda's help and the Black nurses at Evansville help. And so we were really able to target specific people in communities through the Cape Center and through the churches, which is really nice to get the views of our target audience. But if we want to do a more widespread study, we'd have to do random sampling as opposed to picking out certain people in a certain community. And so these are our recommendations for continuing the project. We like to have a more direct community-based approach because as we were able to tell from the focus groups, a lot of the people relied on community members, whether that be daycares or grandparents or family members. And so reaching out to a whole community would hopefully get people to change this behavior more quickly. And then as Kayla mentioned earlier, a stronger fear appeal, which is what Rashonda was talking about with our babies are dying hashtag. And Kayla's group did say that that is something that they would be able to actually follow if they were to see that in a campaign. And then the last thing would be to further education. So especially the education of the older population, since those are the people that don't understand the full aspect of safe sleep and why that should be utilized. Those are the people that we really need to work on educating. And then for the younger mothers, possibly to educate them as to other ways to put their baby to sleep, whether that be enforce more strict bedtime routines so that they're actually able to practice safe sleep methods, or if there are other ways to soothe the baby to sleep so that their babies can go to sleep quicker but in a safe way. So we'd like to say thank you for letting us speak to you about our project that we've concluded. And the last thing we'd like to do is just take a few minutes to explain to you what this project has meant to us and how this will help us in the future. So for myself, I would like to start by saying I've enjoyed this project. This is my second semester doing it, and it has really helped me because it really helps you see how to collaborate with other people. We're all different majors, so it's been very interesting to see what everyone can bring to one presentation to get a complete project. And then it also gives you an aspect of the real world because you're able to collaborate. We're able to collaborate with the Vanderburgh County Health Department in a professional way, and so before you graduate, you're able to see, what it's like to work on real-world projects and work with people from different areas of studies.
Excuse me. For me, it's definitely broadened my perspective as a new member to the GAP team for infant mortality. It's broadened my perspective on the issue at hand. I didn't even know that infant mortality was a problem in the Evansville community. When I think of infant mortality, personally, I think of like third world countries, stuff like that happening, but it's very close to home. You don't think of a small town in Indiana this being an issue. So as a public health major, I think it will definitely help me just broaden my perspective about healthcare concerns within the community at large.
For me, I'm also a first year. This is my first semester working on this project, so it did open my eyes. I mean, I knew it was kind of an issue, but working firsthand and learning and the different perspectives has really just you're like, wow, you don't think about that every day. And then also I worked really close with Rashonda, so learning how to email and effectively communicate in a professional was really something that I took away. And then hopefully as a future physician, this has opened my perspective on how different generations really change things and they really make an impact. So just implementing that.
And this is my second semester on this project, so I really like the whole project. I'm really passionate about it, and I really enjoyed actually getting to go into the community this year and do a focus group. It was really, really cool experience.
Wonderful. Well, let's give them a round of applause. And open it up to questions.
So can I have the presentation for community meeting on the 12th? No, the reason is we have a fetal infant mortality review meeting on the 12th of this month, which is just a week from today, and it would be wonderful to be able to share this because everybody every community member that sits at that meeting, this is their passion as well. I think that they'd be very interested in hearing that generational stop point, and seeing the difference in between knowing what's right and doing what's right. There's that gap, and so I think it will be eye-opening for those that are at the hospitals, those that at the universities, at both universities, and then just our community partners, like March of Dimes and a lot of people. So I would love to take this presentation and be able to just cut it down a little bit and give them an update on the strong work that you guys did. So we can make plans moving forward on what we can do to address this. Joe, Spirit, you got anything?
I would just say that this has been a great project for the health department. We have big goals as far as this type of situation is concerned, and we're launching a new program. We've just received a safety pin grant this year, which will be for the next 4 years. And so this research, this type of information is going to help us focus that grant, focus that work, those programs that we have. So it's really a tremendous help to us to see the effort that has been put in and really the results of it as well. So it's going to go a long way for us to continue this work, and so we really appreciate everything that y'all have done here and working with everybody here at U of E. So.
Yeah, I think you've done a very good job, and it shows the diversity and scope of public health. It's not just treating diseases, it's a lot more than clean water. It's safe children, raising children into adulthood, getting through some of the toughest years of their life. Up to age 1 is really a very tough time for a child, you know, because they are totally dependent upon somebody else to do everything right. And I think you guys really did a very nice job, very well done, and uncovered a lot of issues that are still out there in the community. That it's going to be something that we hope to address in our new program. We're starting like phase 3, I guess, of infant mortality, and we're going to be looking at home visitation, obesity, smoking, opioids, safe sleep, the whole gamut, and using evidence-based text to try to inspire or educate on the first 3 years of life for a child. And I think if we can get a child through 3 years without a lot of adverse childhood events and safe, and I think you guys' comments about third world country, that was my comment a couple of years ago, that we're worse than a lot of third world countries with our infant mortality, and we have to correct that, because that is a mirror on our health care and our care of our children. It's a major mirror, and it doesn't always look good when you're looking into it and have these kind of issues. So thank you very much for, this was very well done. And we will use this going forward, and I think Lynn will use it too.
Yeah, I'd love to be able to present this next week, just so that our community partners, everybody that's got a passion for fetal infant mortality, can look at this component of it.
I think it's very insightful about the generational bit that we need to keep in mind, that we're educating moms, but we need to educate everyone, and that generational, especially with African American, we really need to focus on doing that generational type stuff, because they do rely on their moms and their grandmothers, and those are the ones that they will allow to care for their infants, and so teaching them the right ways would be good.
Or the reason behind the right way.
Yeah.
So they can make change.
I think you girls did a magnificent job. I'm proud of you guys. The information that you delivered was spot on. And I just want to thank you for your professionalism throughout this project. I know sometimes, especially you, I know sometimes it wasn't, especially like within the focus groups, you know, people get candid, so.
It's real life, isn't it?
Yeah. So I just want to thank you guys for your professionalism, and thank you for being flexible with me and my schedule, because things get crazy with me sometimes. So you guys did a great job, though.
I was the one who ran